This is Dr. Eric Wallace, physical therapist and Titleist Performance Institute medical practitioner. What I want to do is go over 4 different movements to master for an optimal golf performance. And these are the simplest types of movements and self-assessments that you can do. And what I would say is that without any of these, you're really going to probably struggle in golfing as well as you'd like, moving as well as you'd like for golf, and you also run the risk of potential injury down the road. So first today, we're going to talk about the neck, medically called the cervical spine. And a lot of people would not think about the neck for their golf game, but it's very, very important in terms of rotation as well as keeping your eye on your target, which is pretty important for a lot of us. So the way that I want to go about this is I want to give you a self-assessment tool that you can use before, during, and after the season to make sure that these 4 spots are moving optimally. And they're pretty quick, simple self-assessments, so it shouldn't take a lot of time. But if something seems like it's off or not right, especially preseason, in-season, postseason, then you can definitely address them as needed. So with the cervical spine, the neck, what you're going to do, you are just going to stand tall. Traditionally, I like feet together, but stand tall. And then you're going to rotate your neck to one side as far as you can. The goal first is to have the chin cross the middle of your collarbone. Then you're going to touch your chin to your collarbone. Okay? And you should be able to do that without cheating through your jaw or your shoulder. So if you see me go, or you see me go, that doesn't count. All right? No cheating on that one. So then you're going to go the opposite way. Okay, and you can see there I have a big limitation compared to my right side. Something that's pretty important for me to address as a right-handed golfer, because what's happening with the neck, again, we don't move our neck apparently a lot during the golf swing, but what we do is we move the lower portion of our neck, or we move our body around our head, which is staying put. So it's really not, this is really not that different than this. It's just that what is moving and what's staying stable is changing. So I might have some issues keeping my eye on the target line. I also might have some issues getting the type of turn or rotation I want without compensating at all. That's one reason for me to really make sure that I address this. The last thing I'll say is that the neck is like the light box or the electrical box for the body. So why I like to start with the neck, and why you should be starting with the neck, is that oftentimes limitations or dysfunctions in the neck will drastically alter, the rest of the body and how it functions and how you feel. And a lot of that is because of the head contains our brain. It contains our how we sense where we are in space, gives us our proprioception and our vision. So it's really important that if you don't have that, it might drastically alter your function, not just in golf, but in other activities as well. Give this self-assessment a shot. Let me know what you think. And if you have questions or problems, don't hesitate to contact us. Thank you.